All right. Oh, moving. Okay, can everybody hear me? This is good? All right, I want to thank everybody for coming out today. We've been watching on the news for some time now. The coronavirus is spreading around the world. There are no reported cases in Louisiana right now, but we want to assure the public that we, as a community, we're on top of this. We have a plan for this, and we're prepared if it does visit our community. I'm joined by various entities, various leaders throughout the community behind me, and I'll read off that list really quickly so you know who's behind me. We have representatives from Caddo Homeland Security with us. We have representatives from Bossier City here. Caddo Parish as well, Christus Health, LSU Health Sciences Center, Ochsner LSU Health, Willis Knighton, the Committee 100, and Shreveport Bossier Convention and Tours Bureau. They're all present behind me. I will step aside and let the representatives from our Emergency Response Center, Dr. White, answer any medical-related questions and any other questions directed towards any government entities. They'll be prepared to respond themselves. Thank you.
Hello, how are y'all? I'm Dr. Martha White. I'm the Medical Director Administrator for Public Health in this region. And really, we just wanted to bring everybody together and to raise awareness, not fear, knowledge, preparation, and to let the public know that their leaders are all working together. We've been planning for events like this for many, many years, all the way back to 9/11, Katrina, Ike and Gustav, H1N1. So we've had a lot of plans put in play, and we're using those plans today. We're improving on those plans every day. We've had meetings with almost every agency that you see here and others. So we want the public to know that their leaders are working to make sure that we're ready if this virus comes to our area. Just also know that the majority of people who get this virus are going to be fine. They're going to get a bad cold, maybe a flu-like syndrome, and then they're going to get better. The problem is there's about 20% of our most fragile people that will get severely affected and perhaps pass away. So those are the people that we want to protect, and those are the people that we are leading our charge for, so that we can make sure that we have as few of our senior citizens, as few of our people with disabilities or chronic disease be affected as possible. We don't have any positives in the state. We have had some testing done in the state. They've all been negative. The testing has been broadened, should I say, so that we are going to have private labs that are now testing. LabCorp and Quest have come online to be able to test. The state will still be able to test. Public Health will know if any of these tests become positive. They're going to let us know first. So we want you to know that we're still on top of everything. We're still aware, and we'll still make sure that all the people that need to know as soon as possible. Does anybody have any questions?
Any questions?
Dr. White, have you enough kits to test, and are the tests being done here?
So the truth is, the reason why we brought in testing was multifold, and one of the reasons is to allow other labs to be able to use different, their kits to test. So those labs do have the ability to test. They are here. Our physicians can order those tests today. And we just had a tabletop, and Knox can tell you about that.
So, good afternoon. My name is Knox Andrus. I'm a registered nurse. I'm the Louisiana Region 7 Healthcare Coalition Coordinator and Hospital Preparedness Coordinator. So this morning, all of our hospitals in Shreveport Bossier and hospitals from multiple parishes outside of Caddo Bossier came together at Children's Hospital, and we went through 4 different scenarios involving a COVID patient presentation in hospitals and how it would impact EMS, hospitals, hospice care providers, nursing homes, several other sectors this morning. And so it was a really good experience, and we had this discussion for at least an hour and a half, and helped us get on the same page with our planning. So,
now, Doctor, obviously one of the most visible things that will happen, if it does, is school closures. So everyone will start to see it, should we have it. Let's talk about the coordination of that, if it comes to that. Who in the food chain kind of goes through this and decides, okay, this needs to be done?
We have representatives from the school board that
We have a chain of command in the school system that I know that you're aware of. It would pass from the superintendent down, it would go through the board, and then we'll pass it on down to how we would close the schools. If there is a need for sanitation or making corrections in the school, we are already planning that, and we've got a plan in process. And as a matter of fact, the other day we sent a notification to parents to make them aware of the things that they need to do for safety measures.
So it's superintendent level then?
Yes, it starts at the once it goes through the health department, they're going to tell us once they find the cases or whatever is happening, right? Is that what
That's
you tell
right.
us?
And we actually have met with
Yeah.
the superintendent's office. We actually met yesterday and had quite a long conversation about their plans, planning for spring break, planning for any
Vacations.
vacations that people might be taking. And also, but really for what the school needs to be preparing for in case they have to close schools.
Right.
Could they tell a school? Could they, what they need to do to keep their patients learning and healthy and their families at home healthy?
Okay.
What is your name, please?
Mary Trammell,
Mary Tremaine.
Caterpillar School Board President.
Dr. White, what is the status as we stand today? Can you affirmatively say right now we are free of the coronavirus cases, and what is your prognosis?
So, let's be honest. We don't have any tests, and anyone who has tested positive for coronavirus in the state. So is it in our community? There's no way to know for sure, but the truth of the matter, it's eventually probably going to be here. So the goal is not to be afraid of that, but to be prepared for that. So right now, I can't tell you for sure. There's no one walking around Shreveport Bossier that doesn't have, that has coronavirus. But we don't have anyone that's tested positive, and we're working already to make sure that we are limiting people's exposure every day. We're doing it now. And we're also working, it's the same thing that we tell everybody every year about the flu, how to protect themselves from the flu. That's a bigger issue right now in our community than coronavirus.
For both of you, Dr. Andrus and Dr. White, there's a lot of concern right now, especially among our population, that people who do not have insurance will be charged for the testing, and those who do not have health insurance will be charged for treatment. That's a lot of people. How are you dealing with that? How can you reassure the public who are gig workers and part-time workers that they won't have a financial emergency if they want to be tested or if they test positively?
So I do think some of that should come from the hospitals, but I will tell you that just like their routine health care, there are 8 places available where they can go and see a physician, and they can be tested. Also, most people will need very little care. So if they need hospital care, that's a level that I think we'll have to turn to.
Yeah, and we can after we all kind of go our separate ways, the hospitals will stick around and can answer questions specific to hospitals as well.
One of the most important questions as we go on is, what's the role that law enforcement is in this whole thing? Because obviously you all have got certain duties, so I'm trying to visualize the situation where
My two law enforcement chiefs can step up and discuss. But I mean, law enforcement, if you call 911, if you're experiencing anything, 911 actually already has the protocols to check, to screen, once you call our 911 system before they call our EMTs or before they call our police officers. So if I miss anything, Chief, like I said, you can.
From the fire department's perspective, everything will begin with the 911 call, because we already have emergency medical dispatch cards in place that establish, once they question and they find out there are influenza-like symptoms, that fall within that category of coronavirus. Then there's some critical questions that they ask. That information is immediately passed on to the units that are responding. If they transport that patient based off our transport protocols, they contact the emergency room department to advise them, hey, we have a potential this type of patient coming in. So all the advanced notifications are made. Once from there, it's handed off to the hospital, and from there, as Dr. White said, that becomes a public health notification going out.
Are there any
that correct?
That's correct.
Chief, are there any different protocols than what you learned from the Ebola several years ago that you implemented?
Protocols are still the same. Our PPE is still the same for any type of influenza-like illness. N95 masks, flu-resistant gowns, washing your hands after you make the call, limiting your exposure time. That's one of the things that we're doing now. We limit the number of firefighter personnel that are in immediate range, 6 to 8 feet of the patient. We allow one person to treat that patient to limit the exposure. So you're taking all of those precautions that you normally would to prevent any type of infectious communication of the disease.
I guess we keep hearing that the coronavirus, the symptoms are very similar to the flu. So what are some of those symptoms that classify only, that are very unique to the coronavirus? And if you do think that you do have this, should you go to the hospital and maybe spread it?
Well, thank you for that question, because that's actually a really good question for us to answer. There is really no specific symptoms just to coronavirus. This is a novel coronavirus. There's a lot of different coronaviruses that are out there every day. Most of our colds, about 40% of them, are caused by coronavirus. This is just a new one. So there's no one symptom that I can tell you, if you have this, you have coronavirus. I will tell you that if you have contact with someone who's had coronavirus, which none of us do yet that we know of, or if you've traveled to a place that's a high risk for getting coronavirus, then you need to be extra cautious. It's going to be in the communities around us, so that travel area is going to get smaller and smaller, and so we're going to be more concerned about who you've been connected with. But that's one of the things public health does best. As far as going to the hospital, what we want you to do is, if you're sick and you have respiratory symptoms and fever, we want you to call your physician and speak to his office. If you feel like you have to go to the ER, make sure that you let them know that you're coming and that you're having these symptoms, so that they can prepare and no one else in that clinic or no one else in that hospital will be at risk if you do have coronavirus. We don't want to have them exposed.
There have been so many questions about the things that you can proactively do. Wash your hands and things of this nature, maybe the arm bump, the fist bump, or whatever. But can you give them the direction in terms of washing the hands? They don't have to use Purell or Antibac, is that right?
No. The best thing you can do is wash your hands with the good old soap and water and wash them for at least 20 seconds. And we used to always say, sing happy birthday to yourself twice, and you've washed them for long enough. But the other thing you have to remember to do, because sometimes we can't always wash our hands, we're not at a place where we can. If you've been touching, like I've been touching things, we've all been touching things, make sure we try to keep your hands off your face. The way you're going to get this virus into your system is through your eyes, nose, or mouth. And so unless you walk into someone's sneeze, really the way you're going to get it is by touching something and then touching your face. So if you wash your hands, wonderful. If you can't, keep your hands off your face.
There's really one big concern in the end, though. When it comes to 2 out of the last 3 pandemics, they are traced back to an emergency room. So there's a lot of fear about is that just going to be an incubator? And that's probably why you say call the doctor, but should we just avoid ERs? I don't want to have them empty, but at the same time, you don't want everyone to be sick.
Yeah. So something that's important, we want to remember, like Dr. White said, that 80% of the people that get this are going to have mild flu-like symptoms, okay? And you're going to do what you would normally do if you had influenza. You would stay at home, away from other people, and you would take Tylenol, Motrin, something like that, drink plenty of fluids, and eventually your illness would resolve. And the 20% of folks that are seriously sick will be in the hospital, will come to the hospitals. So we're planning for that. But, those other folks, they need to be reminded that, unless you're significantly ill, you really don't need to go to the hospital. You don't need to go to the ER. And possibly, you know, in your journey to the hospital, come in contact with someone else that's ill, okay? So let's stay at home if we can. Of course, be in contact with your provider to help coordinate whatever care, make them aware of, you know, your situation there at home, but don't rush to the ER to care unless you have a serious illness, emergent illness. So.
And can I just say, you know, a lot of these questions just remind me, we want everybody to understand this is just your regular daily life, right? So police is going to be doing what police does every day. Fire is going to be doing what fire does every day. Hospitals are, and so is public health. The mayor. So we want everybody else to go about their daily life, to not let this change it dramatically. Just be aware of the fact that people around you could be sick just like any other time, every year this time of year, I should say. And make sure that you're protecting yourself from illness. And if you do that, we should be good.
Was there any suggestion that people should get flu shots?
Oh, yes. So, you know, I'm the flu lady, so I try to get everybody to get their flu shot every year. It's very important. It cannot give you the flu. It will not give you the flu. It will protect you from the flu. You may still get the flu, but if you get it, it won't be near as bad. You're not as likely to transmit it to somebody else, and it'll be a lot shorter. I actually got my flu shot, got the flu, had it for 4 days instead of 14, and really was up on my feet and doing well. So yes, please get your flu shot. And we are still at a very high level of flu in our community.
But what would be the impact to getting the flu shot and preventing the coronavirus? Can you talk about that?
So it's not going to cross-prevent, but it does help eliminate a little bit if you know that, well, she's had her flu shot, it's less likely to be flu. They are still going to test you. And one of the things that we're asking physicians is to remember to rule out all the other possibilities, because it's most likely what's common is common, and what's most likely going to be is some of those routine viruses that are out there all the time at this time of year.
Go ahead, Tom.
The CDC is working on the strains for the flu a year ahead of time. Have they already come up with the strains, and would they, if they could find the strain for COVID-19, would that be included in a flu shot?
I don't believe they'll ever do a mixed vaccine like that. They may, you never know. But COVID-19, they're working on vaccines for. They're in process. It's going to take a long time because we don't want to go and rush to give a vaccine to people that we're not sure is safe. And then a year from now have a lot more complications from the preventative medicine than we have from the disease itself. That's why we're not rushing. As far as influenza, we're still in the flu season for this year. The flu shot is out. It's been out since September, October, and we still have a lot available. So we want everybody to use it all up so I don't have to waste it. And anyways, but no, so that's the answer to your question.
One last question. How many people up there in the podium are carrying Purell or hand sanitizer?
Yeah, most of us are. I want to wrap things up at this moment. And again, the healthcare systems are going to break out. The school board systems are going to break out as well. Government entities are going to break out, and you all can do interviews one-on-one. But before wrapping up, I just want to thank the community leadership behind me. I said healthcare systems are represented, law enforcement, we have city council members here, our sibling city in Bossier is here standing with us, and I want the public to know, hey, this is nothing for us to freak out about. It's not in our community right now, but if it does visit our community, we're more than prepared, and we're going to stand together and fight this. Thank you all.